Hi, my name is Josh Chan, and I'm a senior at Redwood High School. Today, I will be interviewing Mary Jane Burke, the Superintendent of Marin County Schools. She is responsible for the Marin County Office of Education, which serves more than 40,000 students. Today, we will be talking about mental health and how COVID-19 will affect public education in our county. My next question is kind of along the lines of the changing situation of COVID-19. And so, with everything that's going on, what are some of the top goals in terms of mental health in our schools?
Mhm. Currently, the top goals in the current situation is to make sure that both parents and students are aware of the resources that are available right now.
Mm.
There are many different strategies that people are using. There are additional, call lines that are available. There is the available of counseling if someone needs it, even though it might be, I mean, it would be, right? Virtual counseling, and we're continuing to provide that. And that really is for students, but also for families, because what we're seeing is that for some parents, being in the situation they're now in, full-time job, 3 kids, expected to homeschool, along with everything else, is that the levels of stress are frankly at an all-time high, which is obviously, very concerning. And in fact, we just got a notice from our Department of Public Health reminding us about how important it is that we use the resources. One of the signals that they were using was that usually there's a number of reports that might go to public health about families that need support through child abuse reporting or other services, and they're seeing that no one's accessing the service. So
Um,
we've just put out some information in that, in that area. So that's one whole area, like the current environment. Okay, then what we know is that this has traumatized a lot of people, including a lot of students, particularly our most vulnerable students,
mhm.
who are not able to access the primary relationships that may have kept them feeling strong and healthy and able to learn. So as we sort of re-enter the system, we're going to have to do a, significant evaluation of how people are. They talk about trauma-informed practices, and we can actually look at one of our districts right now that's actually implementing a 3-tiered system. If you're under right now, if you're doing well with distance learning, we're good, right? So you're good. But let's take the next student. They haven't heard from them, right? What's going on? And they're actually making home visits right now to make sure that the kids are safe, so that they can check in with them and make sure that they're okay. And then for some students, even with those 2 interventions, they're still not engaging. They're actually bringing them back to campus to have them work within the public health guidelines in small cohorts. So I think we all are going to need to be aware. I just talked to a mom today, and she said, I quit homeschooling. I'm just quitting this. I can't do it anymore. My daughter is upset. She was crying last night and telling me that she hated every single subject,
Mm.
right? And her mom said to me, but she loves math, but hated every one of her subjects. And so I talked through with her a little bit about, okay, well, let's just talk about what's really important, right? And I'm not sure it's going to be those subjects right now. What's way more important is your relationship with your daughter.
Mhm.
And it is, you are not expected to be the teacher. I want you to encourage learning for sure, but I don't want you to be in this director role that puts you in the conflict. That's just not going to work in the long haul. So I said, so my advice is, here's what we're going to do. We need to find what are the areas that make both of you curious, what will be interesting to her. And the mom said, yeah, but I'm working full time. Working full time. I said, well, the things are going to have to change, and that's going to involve that each of you are going to commit to each other that no matter what, you're going to spend a half hour a day in addition to other activities that are interesting and motivating, just together on a walk. No devices, just reconnecting. Because when this is over, there's going to be school. But the parent child relationship will be very, very important. So I gave her permission to quit homeschooling and to get going on what really matters, which is relationships, right? Resilience the mental health, but this child was saying, hey, this is too much. And this mom was saying, it's too much for me too. And so I think that's really important messaging for all of us right now.